We'll be presenting on bone marrow aspirate concentrate harvest techniques applicable to and practical for orthopedic sports medicine surgeons. The author's disclosures are listed here. Bone marrow aspirate concentrate, or BMAC, is one of several orthobiologic substances being heavily studied in orthopedics. BMAC has been demonstrated to have a favorable profile of growth factors and cells thought to potentiate healing in the surgical setting for a variety of purposes. While many studies demonstrate the posterior superior iliac spine, or PSIS, to be a rich harvest site for BMAC, and some consider it to be a gold standard, its location often requires separate positioning and draping during most procedures in sports medicine. It is practical to have the ability to harvest BMAC from multiple sites adjacent to the site of surgery to facilitate surgical efficiency. After the bone marrow aspirate is harvested, it is prepared in a centrifuge system. The centrifuge functions to concentrate the cellular contents and growth factors. These are then separated out, and the yield is typically 2 to 5 milliliters of concentrated bone marrow aspirate. The authors recommend harvesting at the beginning of a surgical case to allow for time for processing. Prior to harvesting, the harvesting needle and trocar are pre-flushed with heparin. Each of two 30 milliliter syringes are flushed and then pre-filled with anticoagulant solution. In total, approximately 60 milliliters of aspirated bone marrow will be obtained. While harvesting sites may vary, the principles for harvest remain the same regardless of location. A small stab incision may be utilized, or the harvesting needle and trocar may be placed directly through the skin. The needle is mounted into a depth of 3 centimeters. The inner trocar is then removed. The first 30 milliliter syringe is applied, and we pull the syringe to full suction. The needle is twisted and slightly withdrawn with every 5 to 10 milliliters of aspirate obtained to continue to break trabeculae and increase access to the bone marrow contents. Once the first 30 milliliter syringe is filled, it is removed, and the second 30 milliliter syringe is applied. The second syringe is filled in a similar fashion, yielding a total of 60 milliliters of aspirate. The inner trocar is placed back within the needle, and the needle is gently removed from the bone. Proximal tibia BMAC harvest is useful for arthroscopic and open knee procedures. The tibial crest, posteromedial tibia, and tibial tubercle borders are palpated. The needle entry location is at a location halfway between the tibial crest and posteromedial tibial border, at the level of or 1 centimeter proximal to the tibial tubercle. The needle is inserted, angling in a direction aimed toward the fibular head. Suction is applied and the bone marrow is aspirated. The needle is twisted every 5 to 10 milliliters. A second 30 milliliter syringe is applied. This syringe will be filled in a similar fashion to the first. The trocar is then replaced and the needle is removed. The authors do not inflate the tourniquet during the proximal tibia BMAC harvest. Proximal humerus BMAC harvest is useful when performing shoulder procedures. In the shoulder, the authors prefer using a lateral approach. The needle entry point is typically just anterior to the halfway point between the anterior and posterior acromion, at a location 3 centimeters distal to the lateral acromial border. This is at the location of our standard direct lateral shoulder arthroscopy portal. The needle should be aimed inferiorly, medially, and anteriorly. Care should be taken to feel bone with the needle prior to puncturing the bone, ensuring that the mallet is used only to direct the needle directly into bone. Alternative sites for harvest depending on surgeon preference for portal placement may be used, such as via an anterolateral approach. The surgeon should keep in mind that the axillary nerve crosses approximately 5 to 7 centimeters distal to the lateral border of the acromion and should start more proximal than this to avoid risk of damage to the nerve. 2 syringes are filled in a similar fashion. The anterior superior iliac spine harvest is useful for hip-related procedures, and the ilium is also considered the gold standard for bone marrow aspirate harvest and could be used for other locations as well. The ASIS is palpated in addition to the inner and outer tables of the pelvis. From the tip of the ASIS, the harvest site is typically 3 centimeters proximal. The authors utilize a stab incision for this location prior to placing the needle. The needle is inserted between the inner and outer tables of the pelvis, and when impacting the needle, care should be taken to remain within the iliac crest and not penetrate particularly into the inner table. The first syringe is filled in a standard fashion. Once the first 30 milliliter syringe is filled, the surgeon may remove the entire needle with trocar for a new bone entry site. The skin is then moved proximally, and the needle is re-entered through the same skin penetration site, but in a different bone entry site proximally. Alternatively, the bone entry site may be maintained, and the needle can be advanced farther to access deeper trabeculae with the second syringe. The second 30 milliliter syringe is then filled in the standard fashion. Thank you for watching our video.